Mr. Birdie, members of the board, we do have 3 items for board discussion this evening. Our first item for discussion is facial coverings in FCSD buildings. Mr. Crapo and I will be doing a brief presentation prior to a board discussion on this matter. Mr. Crapo, if you wouldn't mind, I think there's a clicker at the podium over there. So I will start the presentation this evening. And I want to be very clear with the board and everyone that's present this evening. The purpose of the presentation is to provide the Board of Education with factual information so that you can have an informed discussion about facial coverings in our buildings. So as everyone has said already this evening, many of our speakers and Mr. Birding, we recognize this topic can be a very emotional one because it directly impacts our students and our families. And parents on both sides have very strong feelings about this matter because it directly impacts their most prized possession, their children. I also want to say we've learned tonight, for anyone that's been paying attention, both sides can bring data and resources to this discussion. We often say that you can form an opinion and you will not have a hard time finding evidence to support that opinion. And both sides have brought evidence forward, not just this evening, but also via email. We've had a lot of emails this week, folks sharing links to articles, statistics, so on and so forth, which again makes this discussion, any decisions that are made very difficult. I do want to commend the board on their ability to work through difficult situations. They've proven that in the past, and sometimes even agree to disagree on certain topics, but to continue to work together for the greater good moving forward. And I'm sure this will be no different. Having said that, let's talk about our current status and how we've arrived to this point. So throughout the pandemic, as one of our speakers said, our district has relied on guidance from the Ohio Department of Health, the Ohio Department of Education, and the Butler County General Health District. All along, we've shared that we would rely on the guidance from public health officials as we make decisions about serving our students in the midst of a pandemic. Again, it's been mentioned this evening, all of our staff members have gone above and beyond to meet the needs of our students in the last 17 months, and I'm very proud of how the district has grown through the pandemic. So this year, prior to school starting, the Ohio Department of Health issued guidance strongly recommending facial coverings for students and staff who were not vaccinated. The district immediately aligned with ODH and issued a strong recommendation for unvaccinated students and staff while indoors at school. Later, the CDC and Butler County General Health District issued strong recommendations for all students and staff to wear a facial covering while indoors at school. Not long after the Butler County Health District issued their recommendation, the district once again aligned our recommendation with theirs. So as of August 19, 2021, we are still strongly recommending that all students and staff, regardless of vaccination status, wear a facial covering while indoors at school. Recently, there's been an increased amount of public pressure for school districts to issue their own mask mandates. At the same time, there's a significant amount of pressure not to issue a mask mandate. Once again, the district has maintained that the responsibility to issue a mask mandate should rest with the public health officials rather than educators. This is where things get a little messy. So some public health officials claim they don't have the authority to issue a mask mandate. I've been trying for quite some time to get confirmation regarding that issue, but have not been able to do so. So I know one local superintendent asked a representative if public health officials have the authority to issue a mandate, and the answer was yes. At the same point in time, I've asked the same question of others and have been told no, they do not. The governor has not come out and said directly that he cannot issue a mask mandate. Instead, he has said that the state, quote, doesn't have an appetite for a mask mandate and that he is leaving it up to local school districts. So not only can we get straight answers, we also get different answers from public health officials at the state and local level. And that's what, again, makes it difficult for us as we try to navigate through the situations. So, for example, I don't believe ODH has revised their original stance on masking. So as a result, our local health department is not aligned with the state Department of Health. The difference being regardless of vaccination status. In addition, local and regional health departments also lack alignment. For example, the Butler County and Hamilton County Board of Health have different interpretations of the ODH quarantine flow chart. If you recall, last summer, our local health department recommended that our bands not practice while Hamilton County bands were permitted to practice. Within the county, there are also multiple health commissioners, and they have shared different perspectives on the ODH quarantine flow chart. As a result, you could potentially have major discrepancies between school districts that are right next to each other. As you can imagine, this has been an absolute nightmare for school districts to figure out. As educators, we desperately want to rely on public health officials at the state and local level for guidance. Unfortunately, even they have a hard time reaching consensus and being consistent on major protocols and procedures, which makes our job even more difficult. This week, Governor DeWine called on school officials that have not instituted a mask mandate to do so, at least for the short term. He went on to say the goal of in-person learning and athletic events for the school year is quote-unquote clearly at risk. As the board discusses facial coverings in our buildings this evening, I think it's important for everyone to realize that State Representative Jennifer Gross recently signed into legislation prohibiting schools in Ohio from mandating that students wear masks. And I did put a copy of that in your folders. She said, quote, "It should be up to parental discretion whether their child should be masked at school or not." She will be a co-sponsor of this legislation as it awaits its introduction in the Ohio House. So this goes back to whether, trying to get confirmation who has the authority to issue mask mandates in our schools. And now for the future, it's in limbo. No one really can predict the future, what will happen with that legislation. I've been told, but I'm not sharing this as gospel because I'm told a lot of things. But I'm told, and again, the purpose of the presentation is to inform. I'm not saying this is a fact, but one of the things that have been shared with me is that the legislators are confident that that legislation will pass. So if that's the case, then that means that any mask mandate that is issued will then not be effective if that actually comes to fruition. But again, I can't predict the future. I don't know whether that will or will not happen. However, I think it's important to let you know, what's going on behind the scenes. So for the final part of the presentation, I would like to share some information about where our neighboring districts stand regarding a mask mandate. As you can see, Middletown and Lakota are requiring masks for all students and staff, K through 12, pre-K to 12, and Talawanda is mandating them for students and staff in grades pre-K to 5. The majority of districts are strongly recommending, and these districts include Hamilton, Monroe, Ross, New Miami, and Fairfield. And lastly, Edgewood and Madison are listed as optional. I do want to point out this data was retrieved from an article on Cincinnati.com on August 16th, which was 3 days ago. I know that there are meetings taking place this week. I know that we are not the only district having this discussion. I believe that Edgewood had an emergency meeting this afternoon. I believe that they quarantined 100 individuals today. So again, sharing what I know up to the minute. But that data is as of August 16th. So this wraps up my portion of the presentation. For the last several weeks, via email, phone calls that we've had, we have talked about, we've stressed the importance that we've shared that we will continue to monitor the data and monitor our own data as we make important decisions. As a district, we have limited amount of data since we've only been in session for 3 days. However, we do have some local and state data, and probably many of our speakers will recognize this data. So at this time, I'll turn it over to the Director of Student Services, Mr. Matt Crapo.
Thank you, Mr. Smith. Good evening, members of the board. First of all, my goal of the upcoming slides is simply to show data that may help in the discussion of masking. The data is generated from our local Butler County Department of Board of Health, the Ohio Health Department, and the Ohio COVID-19 Dynamic Dashboard. This is the most recent data that we were able to get our hands on, and while I say that, at 4 o'clock, Butler County did release an update. So as we go through the slides, I will show you, as of this morning, the most recent data, and then there are a couple slides where I'm able to add some additional information on because it was released at 4 o'clock this afternoon. So, to start with, we have state versus county. As of 8/17/21 for the month of August, you can see there's been 31,006 cases, 1,078 hospitalizations, and 26 deaths in the state of Ohio. In an effort to narrow our focus, we can see that there's been 903 cases, 28 hospitalizations, and 1 death in Butler County. The zip code comparison. This is one piece that I will be able to add information on as it was updated after we were able to get your folders together. Again, we're breaking the data down further here to showcase by zip code. This chart demonstrates how many cases, the change in percentage, and the percent of cases in the community. We like to use this graph as a general guide to help us make decisions locally. This is the latest chart available to us and originates from the epidemiology report released on 8/12. Again, there was one released just this afternoon, and showcases data from the week of 7/25 through the 21st. Fairfield City School District is composed of multiple zip codes, 45014, 45011, which also includes Fairfield, Hamilton, New Miami, and Lakota, and 45015. We can see that there's 59 new cases in 45011, 43 cases in 45014, and 8 cases in 45015. We can see that there was no change in percent for the 45011, while there was a decrease of 6.5% in 45014 and a 20% decrease in 45015. A 6.5% and a 20% change in data are fairly severe, and we'll make you take another look at the data on this page. As you dig deeper, you can see that the decrease in 3 cases caused a 6.5% change in 45014, and a decrease of simply 2 cases caused a drastic drop of 20% in 45015. We know that with a small number of data, a small change can swing percentages drastically. The last thing I'd like to point out before, and I will give you some updated numbers, but the last thing I'd like to point out with this graph is while we like to use it as a local guide, we are unable to find patterns with the number of cases per zip code and the decisions made by school districts on whether or not to mandate masks. Without schools in session, this is just one of the few resources that we have to go off of. To give you some updated data that again, just came out, if you wanted to update it, 45011 has a total number of 7,150 cases, 78 new cases with a +10, and they were upgraded to high transmission. 45014 has a total of 5,161 cases, new cases 50, changing cases a +5, updated to high transmission. And 45015 is 1,068 cases, 13 new cases, and a change of cases +4 with also a high transmission. The percent of cases virtually did not change. It's the far column on the right. This graph shows the reported cases from December 2020 through 8/11/21 with a 7-day moving average. The months are located on the x-axis, and the y-axis has a scale of 100. The visual will show you where we're currently at as a county over the course of time. The next slide is Butler County hospitalizations. This graph will show you the number of cases that have been hospitalized per 10,000 residents. The graph again will show you the months on the x-axis, and the y-axis will have a scale of 2. This next slide is cases under the age of 17. Here we see the number of minors that have been tested positive by zip code since July 1st. Again, Fairfield is made up of multiple zip codes, 011, 014, and 015. The zip code 011, it's a very large area and services not only Fairfield but Hamilton, New Miami, and Lakota. Since July 1, there's been a total, 44 total cases in 011, 28 cases in 014, and not enough data to meet the threshold in 015. I would like to give you updated numbers as of this afternoon. For 011, 59. For 014, 34. And 015 still remains below the threshold. Next slide, we have vaccination rates. Here we see the vaccination rates by age group for Butler County as of 8/3/21. For our school-age students, ages 12 to 14, we have 32.4% vaccinated. For ages 15 to 17, we're slightly higher at 37.2. Again, these numbers reflect the county. In total, there are 10,773 of the estimated 20,134 Butler County children ages 12 to 17 vaccinated. Again, I do have slight adjustments that I can add to that slide for you. Ages 12 to 14 is 34.6%, and 15 to 17 is 38.8%. Again, my goal for these slides is simply give you the data. Give you the data by state, give you the data by county, and do the best we could by giving you the data by zip code for our students that attend our schools. So with that, open it up for questions or comments.
Any questions for Mr. Smith or Mr. Crapo? Okay, I guess not at this time. We can, as we go through our discussion, if you could just be available. Okay.
Sure thing.
And so we released a statement the other day just letting everyone know that because the governor asked schools to mandate masks, and we don't have currently a policy to mandate masks, we should at least have that discussion. We felt it was in the best interest of the school district for the board to discuss it, because we can't talk outside of board meetings on what we should do as far as facial coverings or volleyball or what have you. So we asked Mr. Smith to put it on our agenda so that we can have an open discussion and an open meeting so that everybody could see what we're discussing. And again, I ask you to please refrain from outbursts if possible. I know it's a heated issue, and many of us have lots of questions and lots of comments to make. And again, I would ask you to please refrain from anything out of the ordinary. So I'll open up the table for discussion. I would ask that maybe Mrs. Shorter go first, because I know this has been a very important subject to you, and you have lots of data that you'd like to share. So that's okay. I'm going to put you on the spot, but is that okay if you go first?
Oh, yeah,
Okay,
that
great.
works. I've got a presentation.
Okay.
So in just trying to parcel through information from the state, information from the CDC, there were some things that I just wanted to highlight. I enjoyed listening to everybody's information and the reasons for their positions. I want to just focus on the data I'm usually the one who will wear my heart on my sleeve, but I'm gonna just kind of step back, and I just want you all to step back as well and just look at the data. If I can just point out a few things. All right, so the first is the objective. The objective here in presenting this is to just give some voice to a few things. The objective of mandatory masking is to improve the likelihood of sustained in-class learning with as few disruptions as possible. Limit the number of students and teachers in quarantine, stave off classroom management issues in K through third grades arising from a mixed mass population, where educators are trying to keep track of who is supposed to wear a mask versus who isn't. And in this presentation, you'll see why that becomes an issue, why that tracking issue is important in terms of quarantines. So the overall objective that I just want you all to know is that the collective goal, from my standpoint as a board member and the rest of the board too, is we want to get all students back in school safely, and we want to keep them in school. Next slide. So this is the fact sheet. So some of these facts may not align with some of the statements made, but I just want to point these things out. So we've got high rate of spread in all the counties in Ohio. The Delta variant itself, if you look at that little graphic that's there, the Delta variant is very different. Instead of the traditional variant that we dealt with last year, where it spread from 1 to 2 people, this one is so infectious it goes from 1 to 5 people. That's a fact. So as of July 18th through the 31st, the Delta variant made up 90% of all PCR detections. So we test, to basically determine what's out there in the field. And so what they have discovered is that the Delta variant, as of July 18th through the 31st, that is becoming the most dominant variant. For August 17th, we reported 3,235 new cases, which was an increase of 1,421 from the prior day. So according to the CDC, the level of community transmission in Butler County is high. So this is the highest level of transmission. CDC warns or recommends wearing a mask in public indoor settings, regardless of vaccination status. So this is very important. The viral load is significantly higher with the Delta variant, and it is more contagious than the common cold or flu. It can make you sicker, quicker, with greater severity. Okay. So these facts that I'm presenting here is a combination of things that I was able to pull together from the governor's press conference and listening to Dr. Vanderhoff as he spoke and addressed various questions. So mask information. Masks can be especially important for children younger than age 12 who are not eligible for COVID vaccines. The American Academy of Pediatrics recommends that all students older than 2 years of age and staff should wear masks at school unless medical or developmental conditions prohibit use. So, without a virtual learning option this year, more students will be in each classroom, which means less ability to social distance, which increases the reliance on effective masking. I've heard a lot of comments about masking, but this information, according to the CDC, basically states that masking does reduce airborne transmission. Yes, the particle size of a COVID viral particle is 0.1 microns. Not disagreeing with you on that. You had your facts right on that. That is true. The most important thing is that we want to limit the amount of exposure in the environment. The reason it's critical for everyone to have on a mask and not just one to another masked person, but for everyone to participate, is because overall you are reducing that viral load, you are reducing those particles in the atmosphere. So, that is important. Next. Okay. So I want to dispel some myths. This is really important because I've heard this a lot, and I want you to know for sure a few things. Can masks interfere with my child's lung development? No, it will not affect your child's lung from developing normally. So oxygen flows through and around the mask. Oxygen flows through and around the mask while blocking spray and respiratory droplets that may contain the virus. So, do masks trap carbon dioxide? No. Reports stating this are untrue. Just bear with me.
Please, Mrs. Shorter,
Carbon?
please. I ask you to please be respectful of
Are we
any
allowed to
kind
ask
of
questions?
information
Are we allowed
that's
to ask
shared.
questions?
If you cannot be respectful, we're going to have to ask you to leave. Okay, we're just getting
So
data,
if you would just
we're
listen
just
to
giving
the
data
information.
and opinion. Sir? That's enough, sir. If you cannot respectfully sit down and listen to the presentation, I'm going to have to ask you. No, sir. We've already finished that portion of our meeting.
Yes.
Could you please either sit down and listen, or you can leave?
So carbon.
Thank you very much.
Okay, so
Mr.
let me
Shorter,
finish.
please continue.
Thank you so much. Carbon dioxide molecules are very tiny when compared to respiratory droplets. That's just the science of it. The molecules can't get trapped by breathable materials like cloth or disposable masks. Masks, can they lead to a weaker immune system by putting the body under stress? No. This is all according to the American.
Sir, I'm not going to ask you again. I'm going to ask you, if you cannot be quiet, I'm going to ask the officer to remove you from the audience.
Yes,
Thank you very
and I was
much.
quiet as I listened, and I appreciated
You didn't
listening
interrupt
to you.
anybody else. Thank you
So
very
at
much.
this point, I'm just trying to speak. If you would just allow me to finish.
Go ahead, Mrs.
Everything that, thank you so much. Is everything that I got from a valid source. This is from the American Academy of Pediatrics. Chemistry, if you look at the carbon dioxide molecule, you'll confirm this. Okay. So, next slide, please.
We vote for you, remember that. We will vote you out.
Ma'am, thank you. Thank you.
So,
This is the beginning of our discussion. No one else has had an opportunity on this board. We're giving each member an opportunity to speak their opinion. Right now, Mrs. Shorter is giving her educated opinion, and then we can take that for what it is, whether we agree with it or we don't agree with it. But we're going to sit here and listen respectfully. And we just ask you to please respectfully listen to her information. Okay? Thank you very much.
thank you so much, Mr. Birding. Okay, so this is from the Ohio Department of Health. And this is basically just showing the COVID cases in ages 0 through 18. What I'm pointing out here is that as of August, if you look at the category of ages 5 through 10, there is a significant increase in COVID cases in that category. This is in Butler County, where we've had 4,936 incidents of COVID in these children under age 18. What I'm just pointing out in this case is that the data seems to suggest that there's an increase in viral transmission in that age category. You know, the only thing that I can say is to just look at the data. I'm just looking at the data. I'm looking at the trends. Okay, next slide. So these were hospitalizations between 0 and 17-year-olds. The reason I am pointing this out is I just want you to look at the trend, and I want you to look at the data. So the worst spikes that we had were back in December 2020. That was when the pandemic was at its height. So from this data, if you look at our summer school range, our summer school started June 7th, ran through July 22nd. And we were on the down end of the curve. You know, we were seeing less and less cases. What I want you to point out, what I am afraid of, what I think is important when we look at the trend line, is what's happened between July and now. At the end of that trend line is August. We are heading in the wrong direction. We're heading in the wrong direction. Next slide. Okay, so this is information from the Butler County Health Department. This is about the guidance on quarantines, because remember, the most important thing that I want to point out here is how do we stay in school? How do we keep all of our kids in class? So the guidance that we have is quarantine is not necessary for students and adults possibly exposed to COVID-19 in K through 12 school settings, regardless of vaccination status, if all the following prevention measures have been in place. Number one is masking for students and staffs regardless of vaccination status. That's number one. Number two, physical distancing. Number three, documented COVID-19 prevention policies. We spent all last year working on ventilation. We spent last year trying to get all of our protocols in place. The number one priority in the Butler County Health Department's guidance on quarantines is masking for students and staff. So let's go to the next slide. Okay. So this slide is a little busy, but I want you to focus on this important thing. If we look at the section that's highlighted, the section that's in red, okay? So does the school have all of the following in place? Masking for students and staff. Number two, strategies to maximize physical distancing. Number three, documented COVID-19 prevention policies. So if you check no, you move over to the question of vaccinations. If you're vaccinated, you move over to yes. That's a totally different column. That keeps our kids in school, okay? If you're no, the next item that comes up is, did the contact consistently wear a mask? And if that answer is yes, then we move right over. The contact is recommended to wear a mask indoors as much as possible. All of this is leading to the kids being in class. So what I have highlighted there is this statement. They can remain in the normal in-classroom setting and participate in extracurricular and sports activities as long as they have no symptoms. The key there is masking. Masking is key in helping the K through 6 unvaccinated population achieve higher levels of in-person, uninterrupted classroom instruction. So what happens if you're no? If that person is unvaccinated, because our K through 6 population cannot get vaccinated, I wish they could, then parents would have that choice. But that population is unvaccinated. And if they don't wear the mask, then we're already going down this line. And it's very clear, according to quarantines, the contact is recommended to follow the normal quarantine procedures. They should not attend in-person school. They should not participate in sports or extracurricular activities. They can return to normal classroom after 7 days if they receive a negative viral PCR test that was performed at least 5 days after exposure. So what I'm trying to point out with this information, with this chart that I understand is busy, the goal is to keep our kids in the classroom. I believe, based on the data that I saw from last year, in-person classrooms are the best way to go. Our kids need the interaction with their teachers. Their teachers want to see them. They want to be with them. They want to be with their classmates. It is not perfect. It's not perfect. I would love to have everyone not wear masks. I promise you. I can't stand this thing. But if I have the choice, if it's up to me, if it's a matter of keeping the children in the classroom, then it seems very clear that the Board of Health, that the state is giving us a message, regardless of whether or not they have the power invested in them according to Senate Bill 22. Regardless of that, they're telling you right here. They're telling you what the priority is. They're telling you what you need to do to keep kids in your classrooms. And so, that is the most important thing here on this chart. If you can move to the next one. So as I see it, just my opinion, the options are you could adopt a mandatory masking for all staff, students, regardless of vaccination status, K through 12. Second option, adopt a mandatory masking for all staff and students, K through 12, for the unvaccinated population. Adopt a mandatory masking for all unvaccinated students, K through 6, until vaccines are available for this age group. And that's really it. I've given some online resources here. There's a way that you can, have tests at home. And one other thing that I want to point out, I've heard a lot of comments about masks. As I said, I don't really like them myself, but I know this. I can wear this mask all day. This is a simple mask with a very effective filter. This is a spacer. I'm wearing it right now. When I place this spacer under my mask, that keeps this mask from breathing or sucking back into me. I can comfortably wear this mask. It's not even, it doesn't stress me at all. I don't have the feeling of suffocation. You can get these for children. You can get them for adults. I'm not going to argue whether or not masks actually keep the viral particles down, because there's proof, there's already proof that that is the case. I'm not going to argue with you. If you're a virologist, sure, hey, that's different. But as far as making that case, no, I'm not going to make that case. The only thing that I am trying to do, I'm not talking about the death rates. I'm not talking about even hospitalizations. I'm talking about what do we need to do to keep the number of quarantines down and to keep our children in this school for in-person learning. The best way we can do it, as pointed out in this presentation that was here, is masking. That is the policy. That is what is being set forth by the state. They're giving us very clear guidance. If we use context clues, inference, it's pretty clear. Masking is the way to keep them in school. No, none of us like it. The kids probably don't like it, but I'll tell you, I don't like shutdowns. I don't like mandatory remote learning because we don't have any choice. And I want to avoid that by any means necessary. So, those are my comments.
Okay. Thank you, Mr. Shorter.
Thank you.
Anybody else to jump in?
Mr. Birding, I would like to go next.
Okay.
Ms. Shorter, thank you for the time. You've done a lot of work, research, and I respectfully appreciate that. And everyone that came tonight, thank you for coming. I know it's hard to not speak, no matter what side you're on. But we are humans, and we need to be respectful to each other. Your perception, your perspective and opinions this evening were great on both sides. There's truth to both sides, as Mr. Smith said. So with that, my presentation is pretty short. I love kids. Anybody that knows me knows I have a passion for young children, students, and their ambition to succeed. And my stance is not for a mask mandate. I think kids need to be kids. I miss seeing their faces. I have a report from the CDC that gives some studies. One was from Denmark. Over 3,000 people were studied wearing surgical masks. And CDC says the study was too small but yet, and this is all on the CDC website, you can put in use of science or use science use. The top study they put up there was from a hair salon in Springfield, Missouri, with 2 hairstylists. Their second study that they get their information from to bring a positive spin to their stats are from a U.S. naval ship. It was self-reported by the Navy, and thank you for serving if anybody here did. They just reported on their own whether they wore the mask or not. So 3,000 were not sufficient, but 2 hairstylists in Missouri was sufficient. Almost 400 Navymen were sufficient, but the 3,000 was too small. Also, there's another on the Annals of Internal Medicine on their website. They go into more detail on that Denmark study. And that CDC study I just mentioned is from May of this year. Also have, and somebody mentioned it earlier, this is on the FDA website. The FDA regulates face masks, including cloth face coverings and surgical masks, as medical devices when they are marketed for medical purposes. Medical purposes include uses related to COVID-19, such as face masks to help stop the spread of the disease. Surgical mask with agents, face mask marketed to the general public for the general non-medical purpose, such as for construction and other industrial applications, are not medical devices. So when they're telling us it's for COVID, it's medical devices. And we do not have the right to mandate that.
Any more comments?
And I thank you.
Anybody else like to speak? Glenda?
I think that there are people on both sides of this issue that are truly passionate and they truly believe that they are doing what is best and their position is the best. And I don't know if it's from my occupation or if it's just from being the middle child, but I tend to play in the middle and say, well, let me poke holes in your story. Well, let me poke holes in your story. And doing that with coronavirus can take you down a rabbit hole of research, a rabbit hole of studies. One says face masks cause hypoxia. The other one says, no, they really don't. And people on this side say, well, the other side is bunk, this isn't true, it's crap, pardon my language. And it goes both ways. It goes both ways. And then you have a lot of parents that are stuck in the middle. I'm kind of stuck in the middle. I want my kid to have the most normal school year she can. I want her to stay in school. And my concern is that with the quarantine guidelines, we are going to have kids in and out of school all year. And I don't want to see that. That being said, I feel like we don't have enough. I looked at the epidemiology report that Mr. Crapo talked about, the one that came out at 4 o'clock today. I was waiting all day for it, hoping it would be out at like noon so I could read it during lunchtime, but I was able to read it before I came in here. And they do say that, relative to population size, under 18, the numbers are going up relative to their population size. And that concerns me. But I feel like right now I'd like to see more data of our schools, of what's going on in our schools. How many kids are masking? How many kids are ending up quarantined before we vote on something like this? I'd kind of like to wait a little bit and see, are we going to see a jump or not? I mean, I don't want to see any kid get sick. I don't. But I also don't want to make a decision based on what could happen.
Any other comments? Mr. Bagley, like to?
Sure, thank you. There's certainly a lot of passion in this room tonight, and it really reminds me of basically a year ago when we met like this in an open meeting to discuss the hybrid model. I hope you appreciate that at that time we met in an open meeting, and tonight we're meeting in an open meeting and sharing our views and giving you an opportunity to share yours. That was an impassioned meeting as well, and it created hardships for our families when we went to the hybrid model. But we felt that gave us the best opportunity to stay in-person learning. And then we started tracking the data, and we've presented lots of data tonight. But this was our data. And that data showed through that we could stop the hybrid model and go to full-time instruction. And that worked for us, right? So I guess my stance might be much like Mrs. Gundram's in that I think the data that matters most is our data, right? The data that we're going to have here over the next several weeks. And so right now I'm not in favor of a mask mandate, but it might be in very short order. So what does our data tell us? If we're taken out of the classroom scenario because of quarantining, then masking becomes a tool to combat that. It's not a political statement, it's just a practical statement. So my thoughts are, we wait and see what our data shows, we track positivity in all of our schools amongst students and staff, and then we quarantine. We have to quarantine where it's appropriate, and quarantining is decided by the Butler County Board of Health, correct?
Well, that's one of those issues that are up for debate in terms of there's a discrepancy in terms of quarantining guidelines. Now, they are the ones who quarantine in this area, but we are still trying to get clarification on some of the guidelines because there is a discrepancy and an interpretation of those guidelines between the ODH flow chart and the Butler County Board of Health. And our Butler County Board of Health is interpreting it differently than the Hamilton County Board of Health, I believe the City of Hamilton Health Department as well. So we're still trying to work through that, but if your question is the Butler County Health Department, are they the ones that quarantine in Butler County? Is that who we work with for quarantine? The answer is yes.
And this isn't going to be a net zero case, right? In fact, there was a case today at the high school. We're not looking for zero, right? But what I'm hoping for is that we're not seeing classrooms quarantined. We're not losing buildings and sending our children into remote learning environments again because it just doesn't work very well. So my hope is that we don't have quarantining, we don't have case spread, and we can move forward. If we do, then masking becomes a tool in the effort to contain it as best we can. My stance.
Well, thank you, Mr. Begley. Obviously this is a very hot topic. From the beginning of the pandemic, we've always said we were going to follow the guidelines and we were going to pass along the mandates that were given to us. Whatever ODH said, whatever Butler County Health District was recommending, but what they were mandating. Currently, they're not mandating, there's not a public health order to mandate a mask. We have a banker at this end of the table, we have an attorney, we have an engineer, we have an insurance executive, a small business owner. None of us are doctors. None of us are healthcare professionals. I believe the state and the county, they have healthcare professionals at their disposal I feel it's their responsibility to come up with the health orders and give us those health orders, and then we enforce those health orders. They have the authority. I don't believe a school board has the authority to mandate a health order that does not exist right now. Right now, it is strongly suggested, or strongly recommended that children and staff, no matter what your vaccination status is, wear a mask in school. And we have that. We're following that recommendation. We are recommending strongly that you wear masks. You don't have to. Just like your doctor probably says, I strongly recommend you don't eat as many sweets. You eat a healthy diet. That's up to you. You have to suffer the consequences if you don't. So, as far as on the bus, now that's a FCC mandate that our kids have to wear masks on bus. There's no way around that. But we are just enforcing that health order. That's not our health order. We're enforcing it. And if the ODH comes down with a mandated mask order, unfortunately, we're going to have to follow that. Like, we don't have a choice. It's their mandate. And it's up to the school board to enforce the state laws and the state mandates that come down. But at this time, we don't have that. We have a strong recommendation. And so what we've done is we've said, okay, that we strongly recommend that you wear a mask. I'm wearing a mask right now. I'm fully vaccinated. I'm not shy about saying that. But I wear a mask just because we are strongly recommended to wear a mask. And if anyone wanted to feel uncomfortable about wearing one, I want them to see the board president is not afraid to wear a mask. I don't think it's really effective, to be honest with you. It's hot. It's hard for me to talk. It's hard for me to hear people. But I also wanted to show that it's okay if you want to wear a mask, if that makes you feel better, then you should, in my opinion. But as far as our discussion tonight, it was very important that we had this discussion because we need to know where each other stands on this. Up to this point, we really didn't know. Like, I came here tonight with all options on the table. What will we do if someone wants to pass a policy? How would we vote on that? I met with our attorney in the background before here to say, hey, look, we have a policy that says 30 minutes, but we're going to have a bunch of people here. How do we get to where we can go past that policy? And I was talking to him as well as like, okay, well, if someone wants to make a recommendation for board action, how do we also do that? So I was prepared for anything. But I value each board member's opinion. And no matter where you stand on this, I think that your opinion is what you feel is best for our students, one way or the other. And I don't think any of us have done anything at any point to be political. We didn't care what the political ramifications were. We caught a lot of heat for doing the hybrid model, a lot of heat. But we thought at the time that was the best way to get kids in the classroom. I also feel that the Butler County Health Commission is, I think, going a little far with the way that they can quarantine people, but that's not up to me. We just have to abide by what they recommend as far as quarantines. We can't help that. So again, like, my opinion is, I trust Mr. Smith to monitor our data. We get weekly reports on how this virus has been going through our schools or it hasn't been going through our schools. And I trust him enough to keep us up to date and informed about what this new variant is doing. And if we need to come back in 2 weeks or have an emergency meeting to do something because it's going crazy, then so be it. But right now, I do not feel that the schools and school boards have the authority to pass on public health orders. That I feel that is for offices that are much higher than the board. And I don't think it's fair at all that someone won't step up and say, at the state level, this is what schools have to do. They're just kind of passing it along, and I think that's wrong. They should, if they want it, they should mandate it. And if they mandate it, then it's up to us to enforce it. And right now, they're not doing that. So we want I truly believe that Mrs. Shorter has valid data. And she's very intelligent, and I respect her. And if right now, tonight, y'all wanted to vote to put this mandate in, I would respect your opinion. I wouldn't vote for it, but I would respect your opinion. And I think that we would move forward as a board, like we've always done. We have not always agreed on everything. So that's my opinion. If anybody else wants to add more to the discussion, I'd be happy to hear it.
I'd just like to say for Mr. Smith, is you and your team are very diligent and very conscious of getting the data so quickly. And Mr. Crapo, you know, what you got this morning and filled in the rest of it this afternoon. You know, thank you for doing that. That's not easy. That's tedious. And the tracking that we did last year, you did a tremendous job with that. And that helps make some decisions. We don't want anybody to get sick. We don't want any child to die. That should be very obvious. Cases happen. But quarantine, if we have to do that, that's not going to be fun. I mean, I'm not going to look forward to that. And that maybe a different decision will come down when that, if and when that might happen. So just know that quarantine can happen. And if, I got 3 kids in the school district, and if we have to have all 3 of them at home, my wife's going to go nuts. But we work through that the same way. So I just thank you for doing what you do, Mr. Smith, and your team. Mr. Crapo, thank you so very much.
I will add one thing that I forgot to add, and that is that the Fairfield Pediatrics Association did send us an email today saying that they recommend that children wear masks in classrooms. And I feel like that's valid for them to say that. But I also feel that's what they should be telling their patients. Mm-hmm. You should be wearing a mask in the classroom. I believe their data. I believe that we're going to have quarantines. I do. I think because of what the Butler County Health District is saying. But at the same point, I feel that that's information that the parent has to decide, do I want to keep my child in the classroom or don't I? And if they're willing to make the risk that their child may have to be quarantined and lose a week of school or 2 weeks of school, then that's what may have to happen. You know, we send a bus down the street to pick them up, but we don't knock on the door to say, you've got to come to school. Parent makes that decision. And so that's my opinion on the matter. I respect the Fairfield Pediatrics. I respect the former school board members that have reached out to us and give us their opinion as well. And I really respect Mrs. Shorter's opinion. I really do. I just think that right now, it's my belief that the public health orders should come from public health officials, in my opinion. Ms. Shorter, would you like to add something?
Yes, Mr. Birding and other board members, I just want to point out that unfortunately, I believe the hands of the governor and the county health departments have effectively been tied. The presentation that I had up there, that was information from the Ohio Health Department. I didn't make that up. It's just, it is what it is. The quarantine structure that they have in place is brutal, and it will have an impact on us.
I agree with you.
And the top priority that they are setting, and the message that they're sending is mask.
And I believe that the other counties around us have different.
That was from the Ohio.
I'm sorry,
Health
I
Department.
apologize.
It was
Okay.
from the Ohio Health Department. And when I went to Butler County's Health Department to find that information, it was linked to the Ohio
Okay.
County. So I think that's pretty clear, that no mask, you quarantine.
That is clear.
That is
Yeah,
clear.
if you
And
are
that's,
not wearing a mask.
if you are not wearing a mask, you are quarantined.
Yeah, the discrepancy is if the person who tests positive is not wearing a mask, but let's say Mrs. Lane tests positive, she's not wearing a mask, I'm in close proximity, I'm identified as a close contact, but I am wearing a mask. That flow chart says, is the close contact wearing a mask? And if you say no, or if you say yes, if you follow the chart, it says that you do not have to quarantine.
Yes.
Correct, so that's from ODH. The Butler County Health Department has taken a stance that if she's not wearing a mask, but I am, and she tested positive, even though I wore a mask, I have to go into quarantine.
So then the Butler County's guidelines are even more rigorous.
Correct.
And all roads lead to this: no mask, quarantine. What I pointed out is that this variant has the capability of impacting so many more people. The curve is not on our side. So, all I can do is present what I found. The science is going to do the rest. So I'm not going to worry too much. I do believe it would be best for us to be proactive and not wait until the train hits us and we don't have options. But I'm only one board member. There's only so much I can do. I can show you where it's at. I can show you the trend line, and I can show you where those guidelines are and where we're going to possibly get tripped up. The science will do the rest. So that's all I can say. That's all I can do. I do believe the science is, you can't beat that. You're not going to beat it. We can try to defeat it. We can hope that things are okay. But the science is going to do what it does. And that's just how it is. I didn't make it up, didn't invent it. We just have to live by it.
Is there anybody else that would like to add to the discussion?
I would. At one point I didn't get to make was that there's also been a number of emails sent to the board, and I want everyone to know that we have read those emails, and I want to recognize Mr. Birding and Mr. Smith for responding to all of those emails as well. So know that you're being heard.
So if there's no more discussion on this, if we were to take action, someone would have to make a motion to amend the agenda to add an action item, and then there would have to be a second to that action item. I'm sorry, to that motion to amend the agenda. So it doesn't mean that it's going to pass, it just means it gets added to the agenda. So does someone want to make that motion to add something to the agenda for an action item?
I will do that, Mr. Birding, regardless.
Okay, and then so you just wanted to, Mr. Shorter, if you could state exactly how you would want that to read so that we can get it properly on the agenda?
Yes. I make a motion that we add to the agenda for tonight a vote to determine the use of or employing mandatory masking in the Fairfield City School District for grades K through 6.
Is there any stipulations to that, like any sort of, like before, when we had the mask mandate, there was certain exceptions. Do you want staff to look at those exceptions and add those exceptions, like for medical and what have you?
Yes, and that would be in keeping with the guidelines that are pointed out by the CDC. If there are special needs, if there are reasons why masking all day for a particular student is not possible,
Okay.
then those would be items that would be taken into consideration
Okay.
for K through 6.
Mr. Birdie, may I?
Yes.
If the board is going to add that to the agenda, I would request that you make it pre-K to 6 instead of just K to 6.
Okay.
If that's okay, Ms. Shorter.
Yes, that's fine.
Okay, so there has been a motion on the floor from Mrs. Shorter to amend the agenda to add an action item that way would be separated from itself. Would you like that separated to itself, or do you want it as part of the consent?
Separated.
Okay. to require a K-6 mask mandate with exceptions that have been in previous policies. Is that
That's correct.
fair to say?
Pre-K.
Pre-K-6, I'm sorry. Is there a second to amend the agenda to add that item? Okay, hearing no second, the motion dies. We will not add that item to the... With that being said, I would like to commend Mrs. Shorter for speaking from the heart and feeling that you set yourself out there to bring this item up before the board and have the public give them a chance to voice their opinion. So thank you so much for doing that. And I think that, yes, I agree. And again, we may not right now be ready for this, but I again applaud you for bringing this up. And I thank you, and I still respect every ounce of energy that you bring to us. So thank you very much. Okay, so the next item on our agenda is service dogs, Mr. Crapo and Mr. Rice. Now, with that being said, if I may pause for a moment. So there will not be a vote on this. You are free to leave. You don't need to stay around for everything. You're more than welcome to stay and hear about our service dogs and other things. But I do thank you for coming tonight and voicing your opinion and being part of the process of our school meeting. So thank you very much. Okay, we'll just take it to a couple minutes to let people exit before we move into that. Would that be okay? Yeah, perfect. Okay. And if you do exit, that would be great in an orderly, quiet fashion so that we can continue our meeting. Thank you so much. Okay, Mr. Rice and Mr. Crapo.
All right, good evening again, and I'm glad to stand here and talk about something a little less big, but we're talking about dogs in schools, and so this is a good topic here. I would like to talk about two initiatives that we have going on to help us make the school setting safer and to focus on the social and emotional side of education. We're looking at adding 2 dogs to the Fairfield family.
Oh, wow.
One would be a security dog at the high school, while the other is a facility dog at South Elementary. I was approached last year by South Elementary in an effort to obtain a trained dog and introduce him to the South family. The school counselor, Ms. Goins, and Mr. Hustle, the principal, did research on how to get this started. After talking with neighboring districts, we found that Lakota has many facility dogs. I think they have 6. I could be off, but I believe 6 in the buildings, and continue to work with the same local agency to grow their program. We've been in contact with the organization and we'll start the process very shortly. This is a pilot process and we want to see how it goes and what goes into this programming. A facility dog is not a security dog. It is not a therapy dog, but it's a dog trained to work with students and staff as a companion and simply be part of the team. The handler in this case would be Ms. Goins, and she'll continue training throughout the process in the course of the dog's service career. There's a vast amount of research available, the positive aspects a trained dog can provide to a school environment, and we're looking to capitalize on this. Again, the idea stemmed from many other school districts going through this process and discussing with them the positives that can come of it. We're very excited with this initiative and will continue to provide updates as we continue. The second dog. As we are all well aware, we recently lost Natty, an important member of the Fairfield family at the high school. Natty's title was a security dog, but she was so much more for our students and staff at the high school. Natty was highly trained to sniff out various narcotics, gunpowder, and prescription pills. We recognize this loss and we're looking to fill the need in the near future. We're working with the same organization and trainer that we used with Natty to find and train the next security dog for the high school. Randy Johnson has agreed to be the handler as he's a true love and respect for these dogs. The process will look very similar to the last time where Randy will pick up the dog, have a break-in time with it. The dog will be introduced to the school and students over a course of time, and during this time the dog and Randy will be attending training sessions weekly until they're ready to be certified. And again, this process was successful last time and we're simply looking to carry on with what we did. With that, Mr. Rice is here to talk about the benefits of a security dog in a high school.
Thank you, Mr. Crapo. As Mr. Crapo said, the loss of Natty was felt by all of us. Natty was a unique pup in that she was trained drug dog, but very much also a therapy dog. A unique dog that would allow special needs students to lay on her in the hallway and smell her. I mean, it was just kind of that a relationship that we had with Natty. So we are desperately in need for another puppy in the building to meet those needs. That unique blend of a therapeutic dog, a friend for students, but at the same time a deterrent for drugs and those sorts of things. One of the things I find most valuable about these dogs is that through the training, it's called imprinting. You can imprint just about any smell into their work to locate. And we will work, just like we did with Natty, to imprint things like gunpowder or different things that are used in ammunition that this puppy will then be able to smell if there was something, God forbid, in one of our lockers. As well as the change of the world is vaping right now. We can imprint different chemicals that are commonly found in vapes. We would have the ability to imprint that into the dog as well as your over-the-counter medicines, your narcotics, your marijuana, and those sorts of things. So I find it to be a huge benefit to the high school. I think about it every day when I'm walking the halls that we don't have that presence in Natty, so how many kids are thinking, well, the guard's been let down and we could bring something in if we wanted to. So I'm excited about this opportunity, and if you have any questions for either one of us, we're here to answer those for you.
Any questions?
I have a comment. Thanks for bringing dogs back. And I'm glad to hear you about bringing in to send the trigger in on vaping. I'm also on the coalition board in Fairfield, and vaping has become a large part of teenagers, and they can put stuff in the vapors and flavor them where you can't really tell what it is. So I'm glad you're training him, the puppy, to smell that out too. That's huge. So thank you.
Any other comments?
How would the funding be accomplished?
So there are two different dogs. The facility dog, which right now we're finding is about $3,000. And with South, we're working out different unique ways to get this done with security grants, maybe with some internal building funds usage. But with $3,000, it's not in one dog as a pilot program. We're going to be able to find a way to do that. With the high school, the last conversation I had with the handler is he is looking to donate the dog to Randy and donate the training for these courses. So as far as the purchasing of the dog and that piece, that would be taken care of.
That's tremendous.
Yeah.
That's huge.
We struggled with that. The first dog, we had trouble finding funding for it.
The last
Well, I
time
think
it was
that's,
roughly $10,000.
Right.
Yeah, and there were some grants involved. I think in this case, many of you know Mr. Johnson, and because we're working with the same individual, he has a great relationship with this individual, and I think the loss of Natty just obviously has impacted our entire school community, but especially Randy. And I believe this individual just, out of the kindness of his heart, wants to donate the dog to Randy. Wow. So that he can have another dog to work with and also donate the training. So it's a very unique and amazing opportunity. So we're really excited about it.
Yeah, that's awesome.
That's great.
Blessing.
Yeah, great.
Any other questions? So do you need anything from us, or just more just a head nod to go ahead and?
This is just, discussion, like, you know,
Okay.
kind of what's going on and trying to, dogs, it always brings a smile to you.
Yeah, sure.
When will these come into play?
So,
Pun intended.
the security dog at the high school would be quicker. We're looking probably, as soon as we can get going on it, the dog is ready. The facility dog would be the springtime. It's a period of an internship, so the facility dog would work with the handler, making sure it, works in the house, works well, going on over the summer and then next school year in the building.
Great, thank you.
All right.
Thank you very much.
Thank you.
Okay, if nothing else, we'll move on to the next item for board discussion, and it's board policy. And Mr. Martin.
Thank you, Mr. Birding. Members of the board, there is one policy for discussion this evening. It's policy DH, which is bonded employees and officers. Back in 2018, there was a House bill that broadened the type of coverage that a school treasurer is required to have as a result of her position. It used to be that you only could have a surety bond, but now you can have a surety bond or an employee dishonesty and faithfulness of duty policy, which is basically an insurance policy. Then this year, House Bill 291 provided for even more flexibility about when that bond or policy could begin. It used to be that it had to begin when the person was appointed or when they were reappointed. But now it can be entered into, you could change between the two anytime during the treasurer's term of employment. Something has to be in place, however, before the treasurer can perform any of her duties. Also, the policy can now cover more than just the treasurer. It can cover anybody the board deems necessary to have the policy. Okay. So those are the changes that are taking place in this board policy.
All right, are there any questions for Mr. Martin? As usual, if we have questions, we could ask you, but at our next meeting, which is September the 2nd?
Yes.
That you'll be asking for a passage of this?
Right,
Okay.
that's correct. That's correct.
Okay, great. Well, thank you very much.
You're welcome.